Rob, thank you so much. Well, we're approaching the 1-year anniversary of Hurricane Ida and the peak of hurricane season in Louisiana. If you haven't started preparing for your hurricane kit or your hurricane preparation evacuation plan, now's the time to do so. With some tips for hurricane preparedness is Dr. Brent Wallis with People's Health. Dr. Wallis, good morning and good to see you.
Yeah, good to see you too.
So, Dr. Wallis, again, we're in hurricane season, in the thick of things, getting closer to that peak of the season, if you will, but not too late to talk about a hurricane plan. What is one of the big things that we've learned from past hurricanes that you really want people to know and do as they prepare for hurricane season or prepare to possibly have to evacuate?
Yeah, unfortunately, we have to do this every year, so hopefully people are getting used to it. But people still forget a couple of things that are really important. With your medical health in particular, if you do have to evacuate and you're in a new town where they don't know you, you need to bring a little information with you. I tell people it's really important to ask your doctor for a list of all of your medical diagnoses so they can know if you have a problem. And then in particular, your prescription medications are extremely important. Having at least a 2-week supply is critical, and try to keep them in their original bottles or bring those bottles with you. So if they need to be refilled out of town, they can tell what you're taking.
And you said in past hurricanes we had people come here and they just showed up with unmarked pills basically, and then they needed a refill. And you run into a problem if you prepare like that or travel like that, right?
Yeah, definitely. Pill boxes are great. They can help you remember to take your medications. But when it comes to hurricane time, you can grab that pill box, but make sure you grab those bottles as well. And, and it's really easy to ask your doctor to print out a list of your medications. The type can rub off of those bottles pretty easily. And again, you don't want to be in a situation where all you have is a certain color pill and you're trying to get a pharmacist to figure out what it is.
Dr. Wallis, what are some other big things people need to consider or even do right now ahead of a possible storm?
Yeah, the other thing to think about is if you have any special medical conditions, you want to take those into account. So, unfortunately, some people are on dialysis, and if you are out of town, you've got to know where you're going to get your dialysis. You can't go for too long without that. Another thing is our patients that actually have mobility impairments. They may not be able to take some of the public transportation options. So if you're in a wheelchair, those are large and bulky. Sometimes you need to make sure that you've got someone that can actually help you get out of town. So keep that in mind as well.
What about preparations, maybe a hurricane kit, food, water, those kind of things? What should you have in those kits?
Yeah, definitely. A first aid kit is definitely important. We always say that it's more common for injuries to occur after the storm than during the storm. So making sure you've got a little first aid kit available, flashlights, non-perishable foods, especially for our diabetics, keep in mind if they're on insulin, they need to keep eating. So it's really important to make sure you have something that you can snack on. You don't want your blood sugar to go too low.
And also keep those pets in mind, right?
Yeah, definitely. If you have a pet or a service animal in particular, you may not be able to go to some locations. Shelters sometimes will accept pets, other times won't. Hotels are the same. So make sure that you're making arrangements for your little friends as well.
All right, Dr. Wallis, some really good reminders. Again, we hate to have this conversation, but a really important one, especially the reminder about printing out your medical conditions if you have them, and information on all of the medications you take and the original pills. Take those, or the pill bottles, take those with you. We appreciate your time this morning.
Thanks. Have a great weekend.